most famous physical therapist on the internet.
Hi folks, I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about the 5 best self-treatments for L5-S1 disc bulge or sciatica. Stop pain. It includes self-tests and exercise.
That's right, Bob.
We're going to, it's going to give you a general overall view. We're not going to go into too much detail, though. Would you agree, Brad?
Well, I wouldn't say that, Bob.
Right.
I was just going to say it's kind of comprehensive,
All
actually.
Right, good. All right, let's
but
do
one
that.
way or another, these people probably have been told they have a bulge at this level.
Sure.
And this is going to really help your understanding and how to treat it.
Or herniation.
There you go. Right.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. We're always doing a giveaway. This week, we're go to the giveaway section under Bob and Brad.
That's
This
right.
week, we're giving away the Knee Glide.
Ooh.
Great device for after knee replacement surgery or any knee surgery, to be honest with you.
Sure.
And it's actually good for arthritis, too.
Oh, yeah.
Yeah.
Absolutely.
Go to Facebook. It'll be pinned to the top of the page, the contest that is. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
That's
every
right.
day.
All right. So, Bob, like I said, we should educate the people on what the herniation or
Sure.
the bulge of the disc is and why you get the pain, the sciatic pain, which you mentioned in the title, that numbness, tingling, or those symptoms that go down the leg and all the way to the foot, particularly
Right.
at this level. So let's take a look at this. I've got my pointer here,
Yeah.
the blue pen with the white tip. So if we're going to look at the L5, which is the lowest vertebra, and S1, part of the sacrum, and right here, can you zoom in on that list? So we've got the yellow. Now, these all actually have nerve roots that come off, but they're cut off because it's a model. So this one, the one in question is right here. It wraps around through the pelvis, comes out, and at this point, this nerve joins with the other nerves up here to become the sciatic nerve.
Sure.
And that's how the term sciatica gets coined. And then this specific nerve goes down, and it kind of goes on the lateral side of the leg all the way down.
On the outside of the leg.
Yep, exactly, all the way down, and it ends up at the great toe or your big toe. Okay,
Yeah.
So
the problem occurs up here, the herniation, the bulge.
they can't see your finger,
sure.
Bob.
That irritates the nerve. That's what it's like the nerve is getting pinched.
So here's a model up here at a different level of a bulging or herniated disc.
Right.
So this actually would be right here interfering with that nerve. So Sam, we're done today.
You did your job.
Yeah, that's right. Someday we're going to tip him over with these wheels. All right. So the next thing is on Bob, we have him not painted but taped with pinkish tape there to show you. Typically, when you have symptoms of sciatica, it could be pain. Some people describe it as burning, numbness, tingling, like cold water running down your leg. I've had all those.
Really unusual sensations.
Right.
Often.
When it's like that, it's probably a pinched nerve. And the general area is the side of the leg, just like we have here, the lateral side or the outside of the foot, and it kind of wraps around to the top a little bit to the big toe. Now, if you look on a computer and you look up dermatomes or where the different nerve roots goes, they have it very clearly where the location is, but in real life, it varies a little bit. So
from person to person.
Right. L4 and L5 can overlap or vary from person to person. So this is not a science. You want to pull that off, Bob?
Well, so in essence, though, Brad, if you're getting pain in this area, going all the way down, all the way to the toe, that's a pretty fair indicator that you might be having nerve problems at L5-S1.
Right.
So that alone is a big clue to a clinician.
Right.
That the first time you see them, what's going on.
And we're going to show you. Actually, leave that right there, Bob. Hold on. We're going to show you some exercises.
Sure.
And one of the key things that if the exercise is the correct thing to do is the symptoms or the pain centralizes. So let's say this marks the pain, like we mentioned. And
let's say I start doing an exercise, and as I do the exercise,
I can't get this tape off.
as I do the exercise, it actually the pain starts to improve in the area that Brad's showing.
So let's say the pain in the toe disappears.
Yes.
Well, that is good progress. I've had patients come in and they say, I'm not getting any better. And I say, does it hurt all the way down to your toe? Because that's where it hurt the first day. And they say, no, my foot doesn't hurt anymore. I'm thinking, good. And I tell them that. I say, we got to continue to do it. Continue to do the exercises, or I'll modify them slightly, give them an option for an exercise. And the next time they come in, they say, well, it still hurts on my back and all the way down to my knee, but from here down, it doesn't hurt anymore. Bingo. Things are going good. Yeah. Continue to do the exercises and do them more often. And eventually, we get it all the way up into the back. And once it centralizes to the back, boy, you almost got it licked.
Why don't we mention another thing? Quite often with this type of bulging or disc, you're also going to get some weakness at the toe extensor.
That's right.
So that's one thing I'll test too.
Sure.
Like I'll do the exercise and then I'll go ahead and push on that toe. You want to show what toe extension is?
Right. So I'll say to the patient, can you lift your toe up off the ground just like that? And I'll say, do it with both feet.
I can usually lift this one, but this one I can't lift off.
Right. Or maybe you can lift both of them, and I push both of them down with one finger, and one goes down very easily. The other one's very strong as normal.
And that's usually what I see. I see that they're usually able to move it, but as soon as I push on it, it just goes right down.
Right. That's another indication that nervous pinch, and that's a little more serious than the...
Yes, it is.
If that gets continually worse, then you may have to go to see the doctor or go to a surgeon.
Yeah, exactly. You got to make sure that if you can't change that,
right,
that's when things are getting bad.
When it gets worse. That it doesn't happen very often, but it's certainly a possibility. Now, common causes.
Right.
Number one and number two are similar, but they're different. Lifting mechanics.
Sure.
Or lifting heavy weights.
Sure.
Now, you can have a lightweight, and if you have bad mechanics, it doesn't really matter. I mean, if you lift up 10 pounds like this versus 50 pounds like this, the 50 pounds may be better on your back because you're using good mechanics versus the rounding out.
Right.
So those two things, poor mechanics and heavy weight. And then, of course, seated posture is a big one.
Well, the last thing I was going to mention about heavy weight, though, Brad, you can actually hurt your back, have good posture if the weight's too heavy.
That's true.
We see that on weightlifters now. They actually fracture their end plates. They have too much weight. Even though they have perfect form,
right,
there's just too much compression. Right. So it's just something to keep in mind.
Yeah, and that's one of those things that if you're a weightlifter, you don't agree with that very much.
Yeah, you don't agree with
until
that
you get hurt.
Until you get hurt, right.
Anyways, that's another...
But another very common cause of this is just poor seated posture.
Right.
Because you learn poor seating. You're going to do it? I'll do it, Brad.
Yeah, as a matter of fact.
I'll go ahead, slump.
We'll get right into the treatment from here.
I'm slumping, and because I'm slumping, what happens is when I do get up, I carry over that position sense to that.
Right.
Maybe not, I'm exaggerating a bit here, but over time, it becomes part of your natural posture. Yeah.
But even when you're in your slump position, Malcolm's studies was very clear that the pressure on the disc is very high in the seated position when you're slumped. So what we say
especially with weight.
Right. Scoot your bottom back in the chair. That alone is a very big point of progress.
Especially if you have a nice solid back chair like this is. This alone is a very good thing to try.
Right. A nice firm chair. Get off the soft sofas and the couches and that soft furniture is no good.
If you are in the soft couch or soft furniture, go ahead and put a throw pillow behind your back. We got one nearby?
We don't.
If not, we go ahead. Oh, it's right over there, Brad. Otherwise, if you're in a hard back chair, you can actually take a rolled towel. The size of the rolled towel is going to depend on how you're shaped. If you have like a large buttock area, that means you're going to have a pretty big hollow area out here, and you need to fill that gap in. If you're a little bit slimmer like I am, have a slight build, you don't need much. And this is plenty for me. I just take a rolled towel. I would start with a rolled towel, see how it feels. Does it feel better?
Yep.
Is it giving you some relief? And then after a while, you can go ahead and, here's the...
We'll have to jump back to the pillow.
Sure.
The only thing about a pillow when you have sciatica is usually you want to have something more specific to that L4, L5, or L5-S1 level. So a pillow can be helpful, but probably not as good as a roll.
Yeah, a pillow's going to be, again, good in a soft couch because you
Right.
really got a full big gap to fill out
Right.
there. So, but after you maybe used one of these for a while and you want to get something a little more permanent, especially for like your car or the office, then they have a whole bunch of, there's a whole bevy
Right.
full of,
Right. But these are a little more comfortable than a towel roll typically.
This is too much for me, way
Yeah,
too much.
It's too big a diameter.
This should be somebody who has a larger gap. This is getting closer, I can tell already. This is softer, and I can lean into it like this.
Yeah, and you will feel it as soon as you put it there. It's going to decrease the pain, make it feel better. If that's not the case, it's either too big or in the wrong location.
And I often like it a little bit lower, and so does Brad, I know, like almost along the belt line or even a little bit low. Find out what feels best. You're looking for comfort here,
right?
To a large extent.
Particularly at L5-S1, that's
Yes.
very low, so you're probably going to be at belt line or possibly lower.
Yeah.
Again, you'll know because it will be very clear. It feels better.
And
This
that-
is just another shape one.
air-filled one.
Yep.
Yeah, this one you can actually adjust the amount of air that's in it so that you
Right.
can this is actually a good one for me.
Yeah,
It's a good,
I thought you
good
might
for a
like
car.
that.
So
Okay, so what about number 2? We talked about bending and lifting. So how do you correct it? We're going to show what we have found the best luck on teaching people.
yeah, good visualization.
Yeah.
This works out good. Worked well with my wife. She got it right away. She understood
Sure.
what I was trying to say.
Right. And I'll have people do this, patients. We use a booyah stick. You don't have to have that. You can use, it needs to be about 5 foot long, a broom handle, maybe without the broom if you get that off. But you'll see what I'm talking about. We're going to, if you could keep your back straight, good, tall posture, neutral posture, it's going to take pressure off of that disc. Okay, so the way we do that, because some people, you may not be aware of it, but if you take this and we're going to use the 3-point contact method. Bob's going to show it right now. My head's touching.
Point of contact. Point of contact. Where's the last point of contact? It's not there right now.
So,
there it is.
there.
Now he's got 3 points of contact.
So I can feel that, all 3 points.
Show 1 point of contact, Brad, if you're doing it wrong. Yep. Look how slouched he is.
Here, let me get this. Maybe this will be more clear. Yeah, my head's not touching now. My sacrum or my belt line's not. So I really need, once you get them all touching, and I can feel the difference on my back. Now, what I have people do is for body mechanics to lift something up. And when you have a problem like this, when you lift up even a pencil, you want to lift with perfect body mechanics.
Yeah, especially if you're having the disc bulge or disc herniation.
Right.
There's no time where you want to bend over. Even like Brad said, if you're picking up a pencil.
Right. Now, I'll have people do this. I'll say, do 10 squats 2 or 3 times a day, not because I want their legs to get stronger. It's because I want them to get muscle memory and really get a good habit of using good mechanics when they do have to bend or squat. I've had people, this video's gone a little long, but I think this information is going to be helpful. I've had people do that and they'll come back and say, oh, my quadriceps are really sore. And that lets me know they probably never
did it before.
Right. So they were always using bad body mechanics.
Yeah. Now, this is a great precursor to exercise. It's
Right.
a great one to do before exercise or to do throughout the day to give yourself some relief.
Yeah, and it's going to depend on how your leg responds. So Bob's going
Right.
to show you a decompression technique.
So basically, I'm gonna put a little traction on the spine.
Right.
So all you got to do is get between 2 chairs. If this is hard on your knees, you can put a pillow below it, and you're just gonna lift up like this, and I'm relaxing the back at the same time. So my toes are touching. I don't know if you can see this. You probably can't see it. My knees are actually off.
He's got air there. So again, you relax some stomach muscles around there, and you're only going to do this. I've had people do it, and they say, "Oh boy, my leg feels better as soon as I take the weight through my
Sure.
arms." then you continue to do it. If it irritates it, make it worse, it's not for you. You could try the second option.
Yeah, we got to show the hanging handles, Brad.
Right,
Because-
exactly. So you'll do that and hold it for 10 to 20 seconds.
Sure.
As long as the leg feels very good with that, you can
And then
do
it might give you an hour's worth of relief, or it's great to do this before you do this next exercise.
Sure.
Too, but I'm going to show the hanging handles real quick here,
Yeah.
Brad. I don't know, Liz, if you can see these over here. These are handles you can purchase. We'll have in a link below. She's going to flip the light over here to give me a little more light.
If you have a pull-up bar at home, that'll work too.
But it comes with these anchors that you can screw into a stud,
Right.
and they're very strong. I mean, what's the weight limit here, Brad? Do we even know?
Well, we're well over 400 pounds
Yeah.
each, so we got 800-pound person we could hold.
So what's nice about this, you can put this in your office or in your bedroom, and you can just go ahead and do this throughout the day, and you can whip off 20 to 30 seconds or a minute, and then your back gets some relief, and it doesn't make a big footprint.
Right. If you have success with the chairs and that traction works, that would be a good consideration. Plus, these are really good for your shoulders and posture. There's a lot of other benefits.
Good for your grip.
Right,
So.
that as well. Let's go on, Bob.
Yeah.
This is kind of the golden rule from McKenzie, the golden exercise, you might say.
Yeah, we got a whole series of videos on this, on how you might want to progress this, but this is a great one to do after decompression. You can go ahead and put your hands underneath your shoulders. You're going to work on doing some micro press-ups here to start off with.
Yep.
You might even, if this is too much, you might start on your elbows, just getting a little bit of extension.
You're only going to progress with these if the leg pain, like I showed before, is getting better, moving up towards the buttock or into the center back.
Yep, so you're going to go further and further. You're going to keep the pelvis on the floor. You don't want to be doing this. If you're doing this, your back is too tight, and you need to work on those micro press-ups for a bit before you progress on further.
Right.
Because eventually you want to get to this point.
Right. Typically, you'll do 10 of these and stop, and then come back. If the leg's feeling better, every 1 to 2 hours, you're going to get down and do these.
Yep, absolutely.
Yep.
6 to 8 times a day, really.
Yep.
You can do these.
And as long as it keeps coming up the leg, you're doing the right thing.
All right, Brad, what's the last thing we better go?
Walking.
Yes.
Walking. We could have put this on the first one, but
Yeah.
these are all important. You're going to do the ones that work. Walking on a flat surface, not up and down a hill or on an uneven surface, and not too far. It should feel good while you're doing this. If it does, continue walking on a daily basis.
Yeah, walking is one of the better things you can do for your back pain as long as it's not making it worse.
Right.
So,
Whoa.
all right, that's a long haul. Thanks, everybody, for watching.
Good luck with that sciatica.